Hello and welcome. This is Dr. Suzanne, and I wanted to tell you about my new book, of course, talking about children and how to raise them. I actually went from my own experience, from my patients' experiences, and my training as a pediatrician to summarize it. And in the book, I talk about being a mother, the experience that starts before when you think about having a child, and I just break it down from prenatal up to college. And this is so amazing because I have so many patients I have encouraged, I have mentored that have done well, including my own children. You know, if you know us, you know that I used to take my children to the clinic with me. They used to have their little doctor's coat coming to the room with me to see patients, you know, since they were in kindergarten. Encouraging them, mentoring them, you know, between patients, giving them examples. And as you know, 3 of my daughters have been to Harvard and are at Harvard. 2 are there now. The older one already graduated from her master's and she did her undergrad at Stanford. So it's to tell you that we have a system and we have a way of raising children that helps foster their success. So stop by Amazon, get the book. It's not that expensive for what you're getting, okay? Knowledge is power. So even if it's $1,000, just drop it. You are investing in your children, your grandchildren, your nephews and nieces, your, you know, mentees, whoever you want to gift it to. I believe it's a great investment. And it just so happened that one of my patients stopped by today. His name is Jabea, and I've known him and his older siblings. He's the youngest of the family, but I've known him with the older siblings, and I've been the pediatrician, encouraging them, and they all are doing extremely well. You know, masters, working on PhDs, double masters, and I'm just so proud. Like, you know, it's all worth it. All this going to medical school, coming to the US, not speaking English at all, and studying and going through the testing of becoming a pediatrician in America, going through residency, fellowship, having children in between. It just strengthened my desire to help children, and this is the best gift for me, to see these children succeed. I am just a proud mama. All right, so if I want to sum up the book, I start by talking about the importance of the mother. The mother is really, really the first teacher of the children, because you birth them, you bring them forth. And before you even get pregnant, you know, if you like me, you start praying, you start covering this child. And when I was pregnant with my first child, I attended Early Childhood Development Conference. And I went to this conference, and I didn't know it was a world-renowned professor who was talking about the different things you can do with a baby, even a fetus in the tummy, and how to guide them, how to raise them. And I just took everything he said to heart. I wrote down all my notes. You know, I was very studious. And as soon as I left the conference, I started doing exactly what he said. And the first thing, I went to a store and purchased those, you know, you have those machines you can attach to your tummy when you're pregnant. And you can make the child listen to music. You can make them hear your voice. And every night without fail, I will attach it to my stomach. and read stories to my future daughter. It was the first child. I didn't know if she was going to be a boy or girl, if the baby was going to be a boy or girl, but I was just talking to them and just welcoming them, praying, and making them listen to music. And I did that for all 4 of my children, of course. But that's where it started. And at birth, right by the second day, I started reading books to her. I do that for all my children, actually. I'm going to say her to reference my first daughter, but I did that for all my children, all right, without fail. I started reading her book right there at the hospital. And then we got home. And because I was by myself, my family wasn't here, I actually had to do everything. And 3 out of my 4 children I had with that epidural. Like, I got to the hospital and it was just too late to get the epidural. And I was just pushing, let this baby come out. And it was really great because the recovery was really super fast compared to the recovery I had when I had the epidural. We get home, I always make sure that I breastfeed, because breastfeeding is the liquid gold for children. It helps them get their brain where it's supposed to be. They have high IQ. It fosters the bond with the mother. And I had this routine with her. I would give her a little schedule, wake her up in the morning, put on some classical music, talk with her, of course, breastfeed her, give her a bath, sing, play, read. We had a little mommy and me time, then feed her again. I just had this schedule for her, and it worked for us. I stayed home for probably 5 to 6 months. I was still learning English, trying to get my papers together, so I really had time. And then I just worked with other mothers, around me to help me take care of her. She didn't go to daycare or preschool until she was 15 months old, when I was sure that she could walk and could tell me a few things. She was very advanced, so she talked early. She did a lot of things early. I potty trained her. In a weekend, she was already potty trained. Started preschool, actually Montessori, at 15 months, and she was in the 2-year-old class, so she was getting advanced training and teaching already at that time. Then after that, she went to a normal kindergarten. But I noticed that my children were just having, high IQs. But meantime, at home, I would do everything with them: singing, music, take to the museums, go to Barnes and Noble every weekend without fail. Up to now, my children are in college. Every time they see each other, we go to Barnes and Noble. We buy books, we sit there, we read, we just bond. It's a great, wonderful time. What else did we do? Lots of extracurricular activities. Everything is in the book, and you will see it. But I break down the developmental stages, but in a different way. You can have that information online. You can have it in textbooks. You can have it everywhere. But the way I present it is really what is important, what I filtered as a mother and as a pediatrician, that you need to pay attention to help your children get to the highest level. Mothers are instrumental for the success of their children. And it is said that depending on the level of education and achievement of a mother, the children will go to that level or higher. So as a mother, you really are the top role model. I know my mother was also my role model. She was totally super successful, multiple businesses. She had a way of thinking that was out of this world and very encouraging, telling me that I could do anything, I could become anything. I use the same thing with my own children and my patients. I just hope you give my book a try. And I'm going to add a video of Jabea here at the end, because it just so happened that he stopped at the clinic today to let me know that he graduated from his master's in business administration, MBA, and I'm super proud of him. Okay, so this is Jabea. He's been my patient since what? Maybe he was 7.
Yeah.
And now he graduated from his MBA, and he came to tell me, and I'm super proud of him.
Yes.
And this is exactly what I do, what I love, encouraging my patients and loving on them. They're like my children, and I'm so proud of him. And I told him, hey, look, you're gonna have to teach me some tricks in finance, okay? Yeah. I am just so happy, so grateful, so thankful for all these children that are doing so well. I have patients everywhere, but I'm just so proud to have so many patients covering all kinds of things. Like, they are so successful, and I am so happy, so proud of them. Like, I'm grateful to God for giving me this platform, this opportunity to make an impact. You know, all the things I went through to be a doctor in America, even if it was just for one patient, I would have done it again and again and again. But thank God, not just one patient, but a lot, many of them, and they are so successful, and I'm so grateful. So if you have the opportunity, purchase the book, and let's do it. Let's rise up as mothers. Let's encourage the children. Let's give them good directions, and we can build a better world. All right, thank you so much. Bye.